Welcome back to the #1 breakfast show in the country, morning at NTV. Let's talk about a very pertinent conversation, Sanitation Week. Yes, that is taking center stage right here in Uganda. Poor sanitation costs this country over 389 billion Uganda shillings. That is according to a desk study that was conducted over 7 years ago. I'm talking about 2014. Fast forward in 2021, that number could have shot up to over 700 billion shillings being lost annually. But I do have Mr. Samuel Mutono. He's the chair of the National Sanitation Working Group, and also we are joined by Andrew to actually expand more on this conversation. A very good morning, gentlemen.
Good morning.
Let me start with you, Mr. Mutono. Yes. Poor sanitation cost this country 389 billion Uganda shillings. That's 7 years ago. What are we talking about now? I just gave them an estimate of 700 billion. What are the costs right now?
We need to do a recalculation, but I wouldn't be surprised if it is now, if it is not double now, given the population increase. Because when you look at the costs include the time lost for productivity, the resources used in treatment, in the medication, when people die, the losses that you incur during losses, the children not going to school because they are not well. So when you add up, because the population has increased, perhaps we are talking about double that figure now.
All right. Let me also bring in Andrew. Andrew, let's talk about Sanitation Week. What is it all about?
Thank you so much, the moderator and our listeners. Sanitation Week is basically an annual event that we conduct to raise awareness on the significance and the importance of sanitation and hygiene. This is a week that started on Monday, and it will be ending this Friday. In this week, when you look at this week, it is a week that brings together the different stakeholders at regional, district, at national level to come together and deliberate about issues around sanitation. In this week, it's the same week that also we are able to, as the different stakeholders that include the state and non-state, we are able to learn and share experiences, but also to draw appropriate strategies depending on the shortfalls that we are having. And in this same week, we are also able to recognize, appreciate individuals, schools and institutions that have exceeded, that have performed well in promotion of sanitation and hygiene. But most important to me is that during this week, this is a week that provides me as a CSO a platform for me to do a temperature check in terms of checking and in terms of assessing the government, whether the policy and the strategies that we have adopted are supporting us to realize our SDG 6 targets.
Go ahead. Let me also talk to you, Mutono. Let's talk about the issue, the correlation between COVID-19 and bad sanitation. What are some of the implications that can come about when people do not adhere to good sanitational practices in this COVID-19 pandemic?
Yeah, I think the most significant impact is on the hand washing. One of the major transmissions is through the hands. The practices in Uganda, we have struggled. We started a campaign around 2005 for National Hand Washing Campaign. Everyone was amazed. We need a campaign for hand washing with soap.
Yeah. To them it was easy.
Yeah. But of course now it has come it has happened that it is one of the significant ways of preventing diseases. Even then we knew studies had been carried out that for children below 5 years old, 47% of the diarrheal diseases are reduced by just hand washing with soap. And the acute respiratory infections also by over 30%. But over time it is being proved that even Ebola, the SARS, and now COVID can be reduced drastically by hand washing with soap.
Indeed.
So one of the major things which we have neglected, it appears small, but yet has very significant impact on our health.
Do you believe in the last 16 years the public has been adhering to all these WASH services?
Washing with soap. When we started, it was about 16% who washed with their hands with soap. But now we are at 38. We hope with COVID to increase slightly. What I have noted that when COVID started, when malls were being opened and so on, hand washing at markets and malls was really very keenly observed. But now when you move around, people again have relaxed. It is a behavior, it takes time, and we need to keep on hammering at it.
Indeed.
Yeah.
Andrew, let's talk about poverty and the adherence of the public to these sanitation and good practices. How has poverty made it difficult for our people in Uganda here to adhere to these good sanitation practices like washing of hands, buying soap and so forth? Do you think poverty played a role in exacerbating the spread of COVID-19 since people are not able to buy soap, water and so forth to be clean all the time?
Yeah, I should say partly. Partly it did affect.
Because I was looking at the study yesterday and 1.3 billion people in the world do not have access to adequate water.
Yeah, that is true. That is true. It partly did that because when you look at WASH as the first line of defense to COVID-19, it requires a level of investment at the different levels, at household, institutional level. So, given that the COVID-19 pandemic had a disruption on people's income and the ability to earn, so it had really a level of impact. However, we in behavior change, we have what we term as small doable actions. Small doable actions are initiatives that may not require money, that you need to implement using local solution, local problem strategy. If you are to install, for instance, a TP tap, it doesn't require really a lot of money. So ideally is that it's about people appreciating the importance of hygiene in countering COVID-19. It's not looking at whether they are poor or they are rich, because actually that can be really
because, Andrew, we are looking at people who have totally no option. The effects of the pandemic actually ravaged them so badly that they do not have any money to even buy soap or water to do the same. So don't you think maybe government should have pitched in at some point to help these individuals adapt to the new normal, which is COVID-19?
Thank you so much. That is true, and actually government came in with the civil society organizations. You are seeing that government came in with initiatives, but government was looking at strategic initiatives so that people would not really intervene in, for instance, restoring water supply. That was very critical. Also, we have seen government and other stakeholders coming in to give a little bit of, I should say, one-off hygiene kits to them, especially the vulnerable. So to the vulnerable that you are talking about, the different stakeholders came in. However, that's not sustainable because COVID-19 is not going to end tomorrow. So we need to look at measures that we can put in place that can empower the local community.
Share with us some of those measures.
Yeah. The measures would be, I would say, what has been done is capacity building. Capacity building in life skills like making of soap, making of the hand washing facilities. Other we have put in is for them to cope up is other than capacity building is that we have done a lot of linking to the private sector, so that the private sector, the private sector is in a position to accelerate the supply chain, and the private sector can bring the products near the people and make them more cheaper. So that one has also been done. Maybe some would add.
All right.
Can I add just
go ahead, Mutalo.
Yeah. One of the things, I don't remember when we did the census, was it 2004 national census?
Yes.
It was found that nearly 97% of the homes have soap. So it's not really a major barrier. I think the challenge we have is behavior.
2020, we are talking about COVID-19 undoing most of the things that we had achieved. We are talking about in 1990, the poverty levels were at around 30%. If you went to 2015, the poverty levels in the whole world were around 10%. Now they are telling us after the onset of COVID-19, poverty levels are going to increase now again by 13%. Meaning COVID-19 is undoing all the good work that we've been doing all over the years. Don't you think so, Mr. Mutono? That by now, more people might be unable to get all these sanitational services that they need to be clean all the time, especially in the rural areas.
Unfortunately, we have not checked the current impact.
And we should.
We should. I know the Uganda Bureau of Statistics carries out what they call panel surveys every year just to test and see. It might be interesting to find out whether there is, but I don't anticipate that soap could have gone below 90%.
What do you think is the magnitude of this poverty in the rural areas? Don't you think they are grappling so hard than the people in the urban centers when it comes to getting these sanitational services that they need?
No, I think in the rural areas, life has continued fairly. I think the people in the urban areas who have lost jobs and the borders, the hospitality industries and so on are the ones who have been most affected. But the life in the village has been quite stable. I know the prices of foodstuffs went down drastically during COVID. Perhaps it has been affected, but I think their situation has not changed. And if you go to the rural areas, actually, for them, they don't even observe the soaps. They think it is a Kampala issue.
Wait, in the rural areas, they don't observe these standard operating procedures? Because they think it's from the urban centers?
Yeah.
So should we assume that there is more COVID-19 in the rural areas because of this perception than in the urban centers?
I don't want to speak authoritatively on behalf of the Minister of Health, but anyway, the indications are not showing. It seems there is a decline everywhere, including if there is anything in the rural areas, it's not quite apparent, at least from the rural areas I know.
So if people are not adhering to good sanitation practices, what are you doing as government to actually bring them back to the wagon?
We have a support of several development agencies, NGOs under the USNet membership who are doing quite a lot. The agencies, like African Development Bank, the World Bank, USAID through the USHA, the GIZs, they are doing quite a lot of, especially in the urban areas, and the NGOs in the rural areas. But one of the things we are pushing, like this Sanitation Week, the idea is to raise the awareness, because sanitation is given low priority at all levels, even at household level. You find that investments in sanitation are not taken seriously. I know we visited about 2-3 years ago a district in the west where you would find a very good house tiled with glasses, but you go to a toilet, mud and water flow. There is no attempt to show that you can't compare the house with the toilet. So we need to also to get the leaders to be exemplary. That was agreed upon. We had a conference a couple of years ago where one of the principles adopted was exemplary leadership. That when the communities can see to them, just look up to them, and they can have the moral basis to go and advocate for better sanitation among the people. We also trying, several agencies are trying to use behavior change communication, the way the likes of the Coca-Colas do it. I mentioned that we had a national hand washing campaign started in 2007, prepared professionally. Even now, UNICEF is assisting the sector to revise and come up with a campaign strategy, communication strategy for hand washing in this country. Should be out soon. So those are the kind of interventions we do. And also we are bringing in more the private sector, as he said, because sometimes people want to improve their toilets, but they can't raise the money in one go. So using their village savings associations and circles, and some banks have actually started making available some mechanism through which people can borrow money to improve their sanitation facilities. You can be surprised even deep in the village. This has started working.
Andrew, what is the, let's talk about the theme for the Sanitation Week.
Yeah.
What is it for this year?
Yeah, the theme for Sanitation Week is good sanitation and hygiene.
Good sanitation
and hygiene for strengthening COVID-19 response. When you look at the theme, it's really highlighting the importance of hygiene
in combating
COVID-19. That's what it is really highlighting. And hand washing has been proven to be an effective way of combating COVID-19, reducing its transmission.
Biggest line of defense.
Yeah, being the first line of defense. And to me, I think when you look at the trend we have been having when COVID-19 stepped in, there was increased adoption of hand washing, and then there has been a relapse. So during this week, my call is to retaliate that actually households, me and you, should not look at hand washing as a compliance issue to access a public place. Should not look at hand washing, as he has said, where the rule of settings are saying hand washing is for the urban. But they should look at hand washing as the first line of defense. They should nurture hand washing as a habit that we can take on. And if we take on that, we are in position to counter COVID-19.
I also understand, Andrew, that it is one thing to tell someone how to do, what to do, and also how to do something. That is another issue. I was reading an article written by Bill Gates and was talking about climate change, that we should stop talking about how to stop climate change, because the climate is still changing, even as we speak now. It was hot yesterday, it will be raining today. So things keep on changing. And he says, instead of telling people how we should combat climate change, we should be telling people how to adapt to climate change. Don't you think it's now more than ever that we should stop telling people what they should be doing to combat COVID-19, but show them how? Give them the services that they need to adapt to the new normal, which is COVID-19. You're telling me to use soap and water. I do not have soap and water, and the new normal warrants me to use the same. So wouldn't you be in a better position to provide for me these services so that I can adapt to the new normal, Andrew?
Yeah, thank you so much. I think I would look at it in two areas. As I've recalled earlier, is that providing handouts is not sustainable. But the issue is ensuring that you empower the communities
with the knowledge that
they need, but also you are engaging a sustainable model using the private sector so that the products are near to them and they're affordable. That is one thing. And to bring to your attention that behavior change is a gradual process and requires robust engagement. It requires adoption of different approaches and strategies so that you get them. You can use sanitation marketing, you can use commercial marketing. I always share with people that why people are enjoying Coca-Cola much more is because of the increased publicity, is because of the increased awareness, it's because of the marketing that they are doing. So we should really market the behavior of hand washing so that it is appreciated, so that it's taken on. But also we need to also adopt the approach of champions of change. We need to look to use our leaders, to use the culture, to use the religious leaders, to use our kabakas, the chabazingas, the kings, to be at the forefront of really sending this message. Because ideally is that if they are at the forefront, whatever they say is really adopted.
I understand what you're trying to say, empowering the individuals in this country with the knowledge that they need to combat COVID-19 through best sanitational practices.
Yeah.
But then it's like telling a parent they should be sending their children to school, but then they do not have the school fees. The good thing is send your child to school, but I do not have the school fees to do the same. Andrew, the government would be in a better position to look for these parents and say, here is the money for you to send your children back to school. This is what we are talking about, Andrew. In the rural metro areas, Mutono has told us 90% of them do not adhere to standard operating procedures like washing of hands and so forth. Don't you think, I'm going back to that same question, because I really want to get your thought on that, we really need to get in as government and give these people the services that they need.
Perhaps if I can
Mutono, yes.
The government is trying its best when it comes to water supply, and also I know, for example, the Ministry of Health has increased the primary health care grant to the local governments, to the health centers.
That's amazing.
Yeah, they have doubled it, and they have now, for example, ring-fenced that a certain percentage goes for hygiene and sanitation. So the government is trying to avail resources and, of course, leveraging also resources from the development partners for sanitation and hygiene. But one of the things, actually, I think it was in India, it takes about $30 to do a toilet. It was found that people could spend $30 perhaps a month on airtime, but they could not spend on
That's true.
on a toilet. If you worked out the communication, for example, the people drinking, the communication, the money they spend on airtime, it is prioritizing, it is advertising, it is packaging that we are being challenged. How do we package this so that people can really buy in?
Indeed.
Yeah.
Mr. Mutono, I talked with Andrew about the issue of climate change. Now with you, I want you to give us a linkage between the correlation between climate change and sanitation practices. Do you think climate change has made it worse for people to adhere to good sanitation practices? Open defecation, when it rains, it will come back in the society. Yes.
Yeah, absolutely. There are areas in Uganda which flood during the heavy rains. Due to part of it is caused by the climate change. Part of it we have degraded the environment, so it is affected. You get the dry season like now. You get a high latrine coverage. But within a short time, when it rains, that is all washed away. And some of the areas I know, like the USAID, the USHA project, is trying to promote sanitation, toilet construction. But people are already coming back that in our areas, you dig just a few feet, you hit the water, you hit a rock or whatever. So, yeah, there has been an impact. The challenge for us, technocrats, is to come up with technologies which can address, which can stand the weather changes.
What kind of technology?
Unfortunately, for example, I know one project, the USAID funded USHA, they've sent around a consultant to look at the various technologies, what solutions different people have come up with so that they design. But unfortunately, for such difficult areas, inevitably it will be slightly more expensive than normally it would be. But we are waiting to see. Because you would need to build like a septic tank.
All right.
Fully constructed toilets, which costs more money. But we shall see whether there are other options.
All right, you can make that addition, Andrew, and you would also be kind enough to tell us who is going to be involved in this sanitation week. Yes.
Just adding that we are having coping mechanism. We are seeing the rural communities coming up with appropriate latrines.
Yes,
that
that's
are
the biggest vulnerable group.
That we term as flood resistant, that are able, they are able to channel off the water and the latrines are not in position to be washed away. We are seeing, I've seen in other areas, the CSOs have been able to build the capacity of the masons and they are constructing cobbled latrines, they're a little bit lined. But as he has said, some of these options are at really small scale and require a lot of investment.
And who is participating in this sanitation week before I crown it?
Yeah, the sanitation week, before we cry, everybody is participating in the sanitation week. We have the Ministry of Health, the Ministry of Water, the Ministry of Education. We have civil society organizations that include Plan International, Water Aid, AMREF. We're having the private sector. We're having the political leaders, we are having the religious leaders participating in the sanitation week at all levels, because
and we have also the media.
The media, actually, yes, the media in there and the private sector in there, because they are very fundamental during the sanitation week.
Mr. Mutono and Andrew, many thanks for having made the time to speak to NTV Uganda. I'm glad we didn't only talk about what sanitation week is all about when it started globally and nationally. We went deeper, talk about the people who are really grappling when it comes to poor sanitation services, climate change, drainage and so forth. Gentlemen, thank you very much.
Thank you too for hosting us.
Indeed.
Thank you, viewers.
Indeed.
Yeah.
You're still watching Morning at NTV. There's a lot more in store for you. Just keep it here. We'll take a breather and return shortly.